Good afternoon, everyone. Bonjour tout le monde. Thank you for joining today's news conference. Bienvenue à cette conférence de presse. We will start out today with brief remarks from the Chair of the Council of the Federation, Manitoba Premier Heather Stefanson, followed by remarks in French by the Premier of Quebec, Francois Legault. We will then take questions from media. It's my pleasure to introduce the Premier of Manitoba, Heather Stefanson.
Thank you very much, Mr. Chair, and I just want to welcome all of my colleagues here today. And we had, as you all know, a discussion with the Prime Minister, a meeting with the Prime Minister this afternoon in the way of a First Minister's meeting. It was nice to finally sit down at that First Minister's meeting and have that discussion. It was something that had been asked for quite some time, so it was good to sit down and have that discussion, and I think a good first step in all of this. What I will say is that one of the things that we did see today is that there wasn't a lot in the way of new funding that is a part of this package that has been put together by the federal government. And so, you know, I think to say the least, I think we were a little disappointed at that. But what I will say is that moving forward, you know, we still want to ensure we just received that proposal today. There's a lot of details within that proposal. We've only had it for a couple of hours, and we want to ensure that we have the time to go back to our individual areas across the country, our provinces and territories, and make sure that you know, we see what does that really mean for our areas. Of course, it is more money than it was yesterday, but again, I think a little disappointing in terms of the new money that was there. So in terms of next steps, we are planning to get together as a Council of Federation to have further discussions on this. We do plan to get together within days, not weeks or months. We all want to ensure that, and I think Canadians want to see that there is a resolution to this. This is arguably one of the most important things that we face as a country and within our jurisdictions as well. And so Canadians are looking to us to work with the federal government to see some sort of a resolution to this. So certainly we're committed to that, and we will be again meeting as a Council of Federation coming forward. So I think I'll leave my comments at that today, and Mr. Legault, I guess we'll repeat that en français.
Thank you, Premier. Je passe maintenant la parole au Premier ministre du Québec, Monsieur François.
Now the Premier Francois Legault. Thank you, Heather. Thank you, everybody. Hello, everybody. We are moving on the funding of the health, but the transfers should increase to the tune of 5% per year, but what we lack at the time being is not there, so it does not solve the fundamental problem of funding of healthcare in Canada. The good news is that there are no conditions. Mr. Trudeau was very clear on that aspect. If we want to invest 100% in one of our priorities, we can do so. Even if we are asked to share data, there is no conditions linked to attaining certain results. So our only obligation is towards our citizenship. So we are heading in the right direction. But as far as the amounts, it is insufficient. Thank you, Mr. Premier.
Questions. Please state your name, your outlet, and direct your question to one Premier, and you will be limited to one question only. Thank you. Merci.
Hi, Chris Rand, CBC. I'm just finding out that there's no follow-up. So just a financial question to begin with. Premier Stefanson. What do you mean no?
No, you can keep asking.
Okay, right. Anyway, so $28 billion a year, that's the increase you were looking for. Do you see this federal offer as an increase in $19 billion, or is it less than $5 billion in new spending, if I make sense?
Well, I'll start, and maybe Francois, being the accountant at the table, may want to take a crack at that as well. But yeah, 28 billion, of course, was an injection that we were looking at in the first year to get us up to the 35%. on the part of the federal government. And what we see from this is it's actually less than 5 billion, I think around 4.6 billion. So that's the comparative. It's significantly less than what we were looking for in terms of, the baseline funding injection into the Canada Health Transfer. Francois?
And for Premier Smith and Premier Ford, when will people in your provinces, both in large hospitals like Foothills and Sunnybrook and small regional centers, when will they actually see their healthcare getting better? If you could expand on this, will you have a deal this spring? How? I'm trying to get to real people here. We're dealing health policy, please.
We embarked on a pretty significant health reform when I got elected in October. We're focused on a number of different aspects, improving the surgical wait times, reducing that list. Pleased to report that one of the measures that the federal government was looking for is a quantification of the COVID backlog in surgeries. We've cleared our COVID backlog, so we're now at a level of surgeries on the wait list that are similar to what they were prior to COVID. So we're very pleased with that outcome. We're also working on the flow through our emergency rooms so that people are able to immediately get access to a paramedic and then get dropped off efficiently, get seen efficiently. And then our next big step is working on primary care. So I'm pleased that the federal government wants to partner with us on expanding out the recruitment so that we are able to bring in more doctors and nurses, and that's going to be the next big push. But I think in my province, people are already beginning to see the effects of our health reforms.
Yeah, well, first of all, I'm glad that we were able to sit down after a number of years, and I always welcome new funding, no matter, small, large. But what we see this as is a starting point. It's a down payment on further discussions. But I'm concerned, and I'm sure other premiers are concerned, is on the existing deals that we have after 4 years. Where does it go? Home care. Who's going to take care of the costs of the escalation of PSW salaries and other costs that increase? So we'll sit down. This is the beginning. I always look at the glass is half full. And again, it's good that we sat down, and I'll never refuse new funding. So let's see. Once we all absorb it, we go back home and we'll have questions. And the Prime Minister is very open. They're there to answer the questions. And we're going to have a lot of questions moving forward.
Kevin Gallagher, CTV National News. My question will be directed to Premier Stefanson, but perhaps expanding kind of on what Premier Ford just finished on, capabilities. You as a group of premiers came here looking for a particular dollar amount. This offer is well below, as you've indicated. What does that mean in terms of the plans you had for your provincial healthcare systems? Will that mean, if you were to accept this deal, striking certain things off the wish list? Like, what does it mean in terms of actual deliverables, in terms of capability?
Well, I think what is just further to what Premier Ford was saying as well. I mean, they have put some new monies on the table. We'll have a look at what that means to all of us within our various jurisdictions. And so, of course, healthcare falls under the jurisdiction of the provinces. We'll continue to do what we are doing. And many of us, and I know certainly in Manitoba, we have introduced a surgical and diagnostic task force, injected $200 million into that. We've made significant investments in health human resources as well. We don't stop doing what we do as provinces and territories. We are responsible for ensuring the delivery of healthcare. And so obviously what we're looking for is the federal government to come to the table as a real partner at the table. And that's what we were looking for today. Again, there are some new monies on the table. We'll continue to see what that looks like moving forward. We'll have those discussions at our COF table coming forward.
Can you, just as a follow-up, just unequivocally here, the offer today, is this getting accepted?
So again, we are going to take this away today, and we're going to have a discussion back at our Council of Federation table. What today was really, I mean, again, we just saw this 2 hours ago, this proposal, and so it's very difficult to digest it in full. So we will take it away and see what it means within each of our jurisdictions and get together again within, days ahead to have those discussions as to, where's our commonalities moving forward and making sure we bring that back to the Prime Minister.
Bonjour, Monsieur Legault, Valérie Payne de Radio-Canada. L'écart est vraiment très
The
important.
spread, there's the gap, but the gap is so important. Do you have the means of saying no when we have the impression that the government is not inching closer to what you were asking? As Heather was saying, we will discuss the matter over the next few days. What I understood from Mr. Trudeau, it was a final offer, even if the amount is much smaller than what we need and what we expected. The offer is there to fund the healthcare for the next few years. If speaking for Quebec, we will invest the necessary funds to get the health system back on its feet. But the long term, the question remains, can we continue to fund the majority of 78% will be at 76% instead of 78%, but it's not tenable in the long term. So we need to have the conversations with the federal government. What is your margin of maneuver? If you say that this offer seems to be a final offer, so what happens if you say no, it doesn't cut it? So what for this imbalance to continue, when we look at the finances of the provinces and the territories, the conference board demonstrated this because of this ever-growing pressure every year on the health, and that we're not catching up. There will continue to be a problem to work with our budgets and even if in the federation there is a large deficit, there is money, there are debts that are non-recurring, so they will have surpluses in the future perhaps. So we'll need to discuss the matter with the government in power over the next few years.
Is any premier at the table thinking of rejecting this offer from the federal government?
So I think I'll start off again. We just saw the proposal just a few hours ago. It will take time for us to digest that. And as I've already stated, we will be getting together as a Council of Federation at a meeting coming up shortly where we'll have those discussions.
And for Premier Legault, over the next 5 years, the government's sort of offering essentially what they offered the premiers in the 2021 election, just over 21 billion. Is that what you were expecting?
Our requests were to add 28 billion to the base, 28 billion a year to the 45 billion that is given every year now by the federal government, and then have an escalator clause at 5%. We got the second part. We'll have the 5% of increase, but we didn't get the good part of the 28 billion that we were asking for in the basis.
Thank you very much.
Bonjour encore pour Monsieur Legault, c'est Marie Bastel.
Again, for Mr. Legault. With regards to the flexibility, I mean, the amount is insufficient in your eyes. You say that you're going to discuss in the coming years with the government. So are you basically saying that you're not going to be able to get more money from Mr. Trudeau at the moment? Well, we will discuss this. For the last 2.5 years, we've really shown a common front, so we need to maintain this common front. And then when we're looking at this situation before us, people in Quebec send 40% of their taxes to Ottawa, and Ottawa only funds 22, now maybe 24 with this agreement, 24% of people's healthcare needs. It's insufficient. Long term, we'll need a new agreement. But you were talking about coming governments to come in the next few years. So maybe you're talking about a different government in the future.
Houston, King, and Eby, please. I'd like to hear your thoughts on the amount and whether you think it's enough. Mais aussi, Monsieur Legault.
Sure, thank you. What I would say is I did certainly appreciate the opportunity to meet with the Prime Minister and a number of ministers, and I do thank them for presenting a real fulsome package, for us to review over the next coming days. But there's new funding in the case that I'll just speak to Nova Scotia. There's new funding for this year in the range of $154 million. Now that's part of a $6 billion budget. So it is new funding. There's significant needs in our healthcare system. So we'll be able to certainly spend that money. Would we have wanted more? Of course we want more. I'll always push for more for Nova Scotians, as my colleagues will for their constituents. But we recognize the new funding. We recognize the confirmation that existing funding would continue, but we'll continue to push for more as well. But the needs are significant.
Can I get the other ones, please?
Thanks. I just wanted to start by reflecting on how important it was for the premiers to be sitting around the table with the Prime Minister talking about healthcare for Canadians. British Columbians want to see us working with the federal government to deliver care at a time when our healthcare system's in crisis. This is something that my predecessor, John Horgan, pushed for a long time. So it was nice to be around the table. It was very good to have that discussion. This proposal is fiscally limited, but I think that it provides a foundation and some reassurance to British Columbians that we're having those conversations and we're moving forward. I'm looking forward to future conversations with my colleagues across the table and also with the Prime Minister and Finance Minister about how we deliver care for Canadians.
Yeah, I'd follow up from the Prince Edward Island perspective. Obviously, we came with some hope and optimism that we would get some additional funding to help deal with the healthcare challenges we have in our province. This will mean somewhere in the vicinity of 47 or 48 million in new money that we weren't booked for this budget. So it's certainly not insignificant. We're at about $1 billion in the upcoming fiscal year in our overall spend. So, we will spend somewhere in the vicinity of 12% of a budget increase to health. This represents about 4 or 5 from the feds for us. So we're always grateful to have more money. But I think what's lost in the conversations that we need to continue to focus upon is that it isn't just money that we need. We need innovations. We need to change how we deliver healthcare. We need to help innovate the healthcare system in many, many regards. And I feel the conversation over the last little while with the Council of the Federation and with the Prime Minister and with federal officials, we've led maybe Canadians to believe that money simply is going to fix this. And that is not totally accurate. We do need money to help with the innovations and to get people within the system to change what they do and maybe broaden what they do. But it isn't just about money. And I think the sooner we can get to a conversation that deals with not just the amount of money we have, but how we innovate and change health, I think the better Canadians and certainly Islanders will feel.
There's not much more for me to add other than to say that it does provide some certainty too, even though it's fiscally restraining. It does provide some certainty projected into the future to allow us to tackle the fiscal equation of health. I would echo Dennis's comments and Premier King's comments that it shouldn't be just about money. It needs to be about modernization of a healthcare system that is really stuck in the 1960s. And some of the conversations that began today certainly help us to develop that. From a smaller jurisdiction, which is perhaps why you lumped some of the Atlantic premiers together, there is a bit of a transformation and an approach here that I think needs to be recognized on behalf of the federal government, in that with the bilats, there is contemplation for complexities surrounding demographics, geography, and economies of scale. And I think that from Newfoundland and Labrador's perspective, that is a win for us. And as opposed to the per capita formulation basis from before. So while we'll always be here to represent our constituents and to argue for more, of course, I still think that this is a step towards the right direction.
Mr. Legault, given the gap between what you asked and what you've been offered, is there going to be an agreement in the next few weeks regarding the federal budgets? Do you think an agreement is possible, or is that something we can just forget? Well, we'll discuss it. We need to maintain a common front between the provinces and territories. A budget will be tabled in the coming weeks at the federal level and in Quebec. So it's best to have some money than no, it's better to have some money than no money, of course, but yes, we will come up with a strategy and see how we're going to try to get more. You discussed with Mr. Trudeau recently. Are you disappointed? You've been talking about this for a long time. Are you surprised? Well, before Christmas, he said two things to me. He said, first of all, that the amount will be substantial. And of course, we might not have the same idea of what substantial means. And he told me that there would be no conditions, that Quebec's jurisdiction would be respected. And that's good news, because that was indeed the case. La Presse, Mr. Legault, what was the word that you used earlier when you heard the offer? Did you use a swear word? I try not to swear. Okay. Madame Stefanson just said earlier that she was looking for a true partner at the table. Do you feel like you've found a real partner?
We have heard from our colleagues, that we did have a number put before us. It was significantly less than I think what we were asking for, obviously, but I think it is something that has been put before us, and it is a step in the right direction, as you've heard my other colleagues say today. So again, we will have that opportunity to have those discussions again at our Council of Federation table, where we'll see what the next steps are.
Hi, Tonda McCharles with the Toronto Star. Really for any premier, but perhaps Premier Stefanson, we were told that the Prime Minister was going to convey to you that this money has to be spent on health, including anything within the transfer envelope. Have you heard that message from the Prime Minister directly behind closed doors today, that this money somehow is only tied to health spending?
Certainly. Well, I'll kick it off. If any one of my colleagues want to jump in as well, please feel free to do so. And, look, when it comes to accountability, obviously, when it comes to accountability within our healthcare systems, we are accountable every day to those in our communities, in our jurisdictions. When it comes to healthcare funding, I know we spend about 40% of our budget is for healthcare, about $7.2 billion in Manitoba. That is significant. Obviously, what we were looking for today is something to add to that, to really get a partner at the table. And so, again, we had there was an indication that there was some monies put forward there, and so that's a good step in the right direction. But clearly, there's more to do in terms of the longer term financing for healthcare in our country.
So I take that as a no. Premier Ford, when you had your conversation with the Prime Minister, was there any discussion that any of this new money has to go into public health delivery of services or public services and not to be used in private delivery of publicly funded services?
No, well, that conversation never came up. This is all about certainty for all of us. It's about sustainability. It's about building a healthcare system, not for 5 years, not for 10 years, but decades moving forward. We always welcome new money. And is it going to transform the healthcare system at 2%? No, it's not. But can we deliver healthcare in a better fashion, more efficient way of delivering healthcare? I truly believe we can. Do we always look at continuous improvement? We do. And there's a lot of different areas that we can focus on to deliver healthcare more efficiently. Like Chair Stefanson mentioned, I think we all need to go back. We need to sit down with our ministers and health experts and finance and see where this puts us. And then we will reconvene, and we just need to absorb this a little deeper. As the chair said, this is 2.5 hours old. So we'll sit down and have a chat and get back to everyone.
Fraser Needham, APTN National News, and this is for any of the premiers or territorial leaders. I note from the press release, it says $2 billion specifically targeted over 10 years for Indigenous priorities. Is that really enough?
Thanks for the question. It's never enough. We are asking for something from the federal government, and so we'll see. Again, we just received this. You know, again, they've had our proposal for 2.5 years, and we've had it for two and a half hours. So we're going to have, you know, really see what the details mean moving forward. But I'm not sure if there's anyone else that wants to jump in to talk about what it means in their jurisdiction as well.
I would just say my understanding of that, and this is why we need, I think, a couple of days to digest what was presented here today and what impact it might have to our respective provincially delivered healthcare systems. But my initial understanding of that particular fund was that would be federally delivered, and so it wouldn't have really much of an impact on any of the provincially delivered healthcare systems that are that we operate here. So, you know, that's an example of why I think we need a couple of days to digest and our teams to digest the detailed information that we were provided with today, figure out exactly what type of an impact it does have for each of us, and then come back with a response as to, you know, where we are going with this funding and what ultimately we could utilize it for, and what type of a difference it may or may not make.
I'd like to add to that, if I can, from the Northwest Territories. 50%, over 50% of our population in the Northwest Territories are Indigenous. I do believe the federal government is really trying to address reconciliation. Part of that reconciliation is making sure that Indigenous people have the tools and the supports necessary so their population can thrive as well. We know that Indigenous people are highly affected by healthcare within the Northwest Territories. Our spending is 4 times the average that other jurisdictions pay per person. So my concern, and I brought it to the Prime Minister and the ministers, is that it can't only be on reserves. In the Northwest Territories and much of the North, we don't have the reserves that you do in the South. So it has to make sure that the Indigenous stream addresses all Indigenous people within Canada. And so that is something I've taken personally, and I will pursue as we go forward. Thank you.
So we have time for one more question, please.
I would just say as well, I had an opportunity to talk to some chiefs before coming out. I think that the dedicated dollars will be welcome. I think that especially when we're looking at culturally appropriate programming for mental health and addiction, for long-term care support, as well as for health facilities on reserve, those are all a priority in Alberta. And so I'll do more consultation with the chiefs when we return. But I think that this recognition that there needed to be a special line item was a very important measure.
One more question.
All right. Good afternoon. Jeff Peltier here with New Natsiak News. My question will be directed to Premier Akiagok, but also the other northern premiers if they want to chime in as well. To what extent does this announcement meet the needs of the specific health needs in the north? And then to what extent after this will there be more work to get a more territorial specific health transfer accomplished?
Yeah, thank you for the question. I too would like to thank Prime Minister Trudeau for coming to the table, but also realizing the unique nature the territories are in terms of the geographic distance, the challenges that we face. And so the CHT is obviously goes through population base. So it's very important for us to ensure that the bilaterals, such as the health investment fund, are where we get our resources as a territory. So it was great to see that. I came here very optimistic in terms of providing solutions to the issues that we've seen. So I'll be spending the next day really digesting what was presented. I think there's always more we could try and secure. As an example, we have huge infrastructure deficits in our communities and challenges in terms of human resources, of keeping health centers open in our communities. So those are things that we continue to push. And I really appreciate my colleagues here who realize and support the unique challenges that we see. So yeah, we'll review what was being presented and yeah, look for more investments as we move forward as well.
Yeah, I think that I mean, I'm new to the table and there's been premiers working on this for 2 years. So my sense was that we were at the table and the conversations were respectful and they were moving forward a deal that people were looking for a long time. And there's new money. For us, we have to take into consideration what's been put on the table is not as sustainable as the provinces. We're seeing a 5-year outlook, but a commitment to renew that, which we need. We can't plan in 5-year cycles. So I think the territorial premiers will have a more extensive conversation. The Indigenous Equity Fund, I think, is going to be very important. Of course, the First Nations leaders that I work with sent us here making sure that their best interests were taken into consideration. So again, the details will be key on how that money flows. But again, we'll come back to the table with colleagues in the next couple of days, and then we'll have a sense of what the deals look like as we go into the following weeks.
I just add on to that a bit. The CHT monies is divided per capita. That's never worked for the Northern Territories. Because of the low populations we have and the huge landmass and the problems to access. A lot of us don't have winter roads to communities. They're fly-in or they're just ice roads, and climate change is impacting that again. And like I had said, our healthcare costs are huge. So I do respect that the federal government is looking at the bilateral agreements and is giving us a base funding to start with before the per capita. It does show that there is a movement in addressing the needs of the territories and the specific needs that we have challenges on. But as said by the other premiers of the territories, we have to look at it, and negotiations will continue to address the needs of the people. Thank you.
Thank you. That's all the time we have today. C'est tout le temps qu'on avait aujourd'hui. Merci. Thank you.
This is all the time we have today. Thank you.